We did have a few more questions to get to, but I'm not sure if we're going to be able to get everyone back online. So I am going to go ahead and share at least a few resources with everyone here tonight. We want to encourage everyone to check out apafdn.org to see any of our free resources to create a mentally healthy nation for all, where you live, learn, work, and worship. This is one of our more recent resources. Everyone listening here tonight is more than just, their work title or their past history or their current mental health status. Above all else, we are community members, and we know that this resource might be helpful in providing individuals with some guidance on coping skills and resources for the whole family. So we wanted to make sure we provided that resource, and it looks like we might have gotten Joe back. Joe, are you able to connect and jump in?
I'm here. Yeah, I don't know what is happening.
It might
I'm
be
sorry about
my,
that. I paid for a gig fiber. I've got super fast internet. I don't know why it's kicking me out.
it's all good. It also might be, we are experiencing a storm, of course, while we're trying to do this event. And it started to like pour intensely right at 9 o'clock. So I don't know if that impacted like internet across the board for myself in the hosting capacity. So Ernie, did we get you back as well?
And Chris, I'm just seeing that it's.
I can hear you guys. I can't see you though.
I can hear and see you, Ernie. I can see that Chris is there.
Yep, and then it looks like Joe might have dropped back off. Oh, Ernie might have dropped back off. Gosh, I'm not sure what's happening. It's probably my internet connection, honestly.
Yeah, I don't know. I got booted out too, which is weird. Yeah.
Yeah, it like kicked everybody out and then rebooted everybody back in. So I'll give it a few more seconds here. We might just have to go no video just because of the bandwidth.
Are we good to go?
Yeah, I think we can hear you, Ernie.
Okay. Do we still have an audience?
We got a few more people. I don't know if everybody made it back on, but we have at least 16 who made it back on after that little kickoff. I know that Joe was talking a little bit about the spectrum of care, and I do want to mention just briefly that we do have we have our own kind of K through 12 education program. And it kind of focuses on that notice, talk, and act piece. And one of the key pieces that we talk about within that is kind of the warm handoff. And I've kind of already touched on this a little bit, is kind of that follow-up that you're doing with those individuals after you get them connected to care. What does that procedure for follow-up with the community members you divert look like? And how can other communities kind of implement that into their practices?
For us, there really was no rhyme or understanding in who we followed up with. And what I mean by that is because we were, looking at doing close to 13,000 involuntary commitments a year in a unit of 10 officers who were paired up. So really 5 teams, and some of those worked on other projects. It was very, very difficult to do the type of follow-up we would like to do. The ones that Joe and I really looked at and focused on were the ones such as Kendra that placed themselves not only in a danger to themselves, but also possibly for dangers for other people, right? Jumping off a bridge, maybe holding themselves barricade, in an apartment complex with access to a firearm or something. So, but then again, you look at the documentary, we had Esteban in there. He was more of a high utilizer where his mom was having to call all the time. So, Joe and I were able to kind of say, hey, let's follow up on this one. Let's take a look at this one. We were very fortunate and still are to have access to clinicians that are on the unit. So on the unit, we have 3 clinicians, and part of their job is to follow up from referrals from patrol that come in as high utilizers. For example, hey, we have an address where an individual is calling in 3, 4, 5, 10 times a month, and it's mental health related. Could you help us out? So we would be able to send an officer from the unit and a clinician to that location to try to decrease the number of 911 calls and close that gap to find out what the need of service is for that individual. So really, I wish we had a better matrix to say, hey, if this happens and then we go this way and then we go down, then that leads to a follow-up. But really, being such a large city and such a small unit, we really had to handpick those. I know that the supervisor right now requests follow-up for any type of mental health call where there was a threat involved, whether it's a threat to self or others, where there is a large police response. So, until they come up with a better way to determine who needs more follow-up due to the acuity of the patient, it's just something that the officers have to rely on assistance from patrol or the calls that they handle themselves.
Thank you, Ernie. Joe, do you want to jump into that one at all, or?
Yeah, Chris, I'd love to if you can hear me, but I didn't hear the question.
Okay, no problem, no problem. Just thinking about the follow-up procedure that you enact after you connect an individual to care. And I think Ernie was just talking a little bit about it, but if there was anything else you wanted to add to like what that procedure is like, or what you wanted to encourage others to think about when they do that follow-up.
All right, I'm gonna try video. Yeah, again, I heard his response. I just didn't hear the direct question. But yeah, there really for us, I think it's one of those things where you have to decide, like, again, figure out like what's the point, what's the goal. And I think a good place to start is identifying your most familiar faces, the people who are, requiring the most are the highest level of care, and then start working with those. Because again, I think what we found was some of our highest utilizers, the reason they called the police so much and the reason they wanted to be hospitalized so much was because they were lonely. It's not because they were a threat to themselves, but it was because they wanted to interact with other people. And so one of our top utilizers, he would call the police daily, sometimes multiple times a day, and say, I want to kill myself. I have a knife. And officers would get there. He'd have his bags packed. He'd hand them his knife, and he would want to go to the hospital. And he told us, he said, look, I just want to go there because I like talking to people. And when he's home, no one talks to him. And so something like that, where you can actually start making visits and whether it's maintenance or whatever, but you show up, you spend a little bit of time with people, and maybe you can prevent or avoid those hospitalizations, which again, only does bog down an already bogged down system. And so really identifying, but the big thing I would say is, when you do the follow-ups, when you have that continuity of care post discharge, whether it's the first time or the 50th time, really get to know the person and find out again what is happening that's causing them to be in that state, and then can we address that need? Because typically what we see is people that have a serious mental illness, especially, it's very rarely that they're just seriously mentally ill. It's usually they have some co-occurring disorder. They're usually, maybe addicted to, at least here in San Antonio, 8 out of 10 of our mental health calls where there was psychosis involved was because it was methamphetamine use. And so now you're dealing with a drug-induced psychosis, and the hospital is going to just really, they're going to see that they urinate on a UA and that they have meth in their system. They're going to stabilize them off that, and then they're going to release them. And we're never really getting to the root cause of why they're self-medicating. And so if you can have, like, don't do follow-up just to do follow-up, do follow-up with the hopes of trying to alleviate or prevent the hospitalization if possible.
Follow up with a purpose. I like that. Dr. Thrasher, I'm glad we got you back here. in the interest of time, I do want to kind of shift a little bit just to kind of give everyone an opportunity here, our panelists, to provide just the key takeaways that you hope, for the psychiatrists who are listening, for the fellows who might be listening, to the community members who might be listening, just your final takeaways or thoughts in just a few sentences. So, Ernie, we'll start with you, then we'll go to Joe, and then we'll end with Dr. Thrasher, if that's all right.
Yeah, for me, we need champions within law enforcement. We need officers who will pick up the torch and champion the cause for mental health. Every community is in dire needs of relying on their police department for assistance, and we've got to get past that's not my job, that's social work. It is our job. It may not be our primary job, but it is our job to respond and provide service within these communities. So within leadership, within rank and file, I would like to see a shift of priority in law enforcement. I know everybody's got needs and wants within police departments on where they think manpower needs to go. But if you paid any attention at all in the last 12 months to what's going on in the communities, and especially when you incorporate a pandemic, you're seeing a huge pendulum swing over towards mental health response. So for those that work with law enforcement, if you're on this presentation, please reach out, be a part of the solution, partner with law enforcement, and encourage them to take the training.
Thank you, Ernie. Joe?
Yeah, thank you, Chris. I appreciate this opportunity. And again, to the American Psychiatric Association, sorry about the technical glitch. It's something we've come accustomed to, and it's been an honor to do this. And I don't even see Dr. Thrasher on here, but to meet him and listen to him speak as well was good for me. So my final takeaway is I imagine everyone in this call in one way or another deals with people, helps people, serves people. And while you've probably all heard the term knowledge is power, just remember that knowledge about yourself is self-empowerment. And I do not believe that you can effectively serve other people for any period of time if you aren't first helping yourself. And self-care is such an important piece for me because again, whether you're the highest level where Dr. Thrasher is as a acting psychiatrist, or you're a first responder police officer in the field, or you're a community advocate, whatever your role and capacity is, it's just as important across the spectrum. And that's what we were talking about earlier. And so it's important that while you are doing a great service to show up and help other people, you don't do it at the expense of neglecting yourself. And I wish everyone well. Thank you so much for having me. And I pass to the great Dr. Thrasher if he gets back on.
It appears Dr. Thrasher has been kicked in and out of the meeting a few times since we last saw him a few minutes ago. So hopefully he will be able to jump back on before we end the meeting to provide some key takeaways as well. But I just want to thank each and every one of you. Oh, Dr. Thrasher has jumped back on. Let's give a few seconds here. Hopefully he can get connected and we can get his key takeaways to wrap up the panel discussion here. Well, thank you so much, Ernie, Joe, Dr. Thrasher, for your time, your knowledge, and your vulnerability tonight. I've already highlighted this resource. I'm going to share my screen again just to share it one more time. This is Notice, Talk, Act at Home, Coping Skills, which is designed to help parents and caregivers trying to navigate heightened levels of stress. This resource will help families better understand common signs of stress, offer ways to manage stress, an example of how you can plan stress relief activities for your whole family. As everyone here today is more than just their title at work, their past history, or their current mental health status. Above all else, we are all community members. And we also wanted to bring to your attention how you can bring this type of screening to your community. And in honor of Mental Health Awareness Month, Ernie and Joe Crisis Cops is available for free to community mental health organizations such as NAMI chapters through June. And the film is available for free streaming to any U.S. law enforcement agency through May of 2022. If you are a U.S. law enforcement agency, there was a message that was dropped in the chat, and we encourage you to reach out to that email as well. And then on the screen, you'll see multiple different ways to connect with the APA Foundation. And the APA Foundation stands ready to help any community in responding with compassion and empathy to community members who are experiencing a mental health crisis. We want to invite you to visit apafdn.org to learn more about the APA Foundation has to offer to your community. Dr. Thrasher, we have you on, and I'd love to give you at least some takeaway points to give to the attendees.
My extensive apologies. I don't know if it's internet connectivity in the Milwaukee area, but I've been kicked off routinely in the past 20. Thank you just so much to all of you for being here. And thank you for the collaborations and the stories of Ernie and Joe. I really think the way forward on this is, as mentioned, a change in culture in law enforcement and a change in culture in mental health and how we work together and how we collaborate. And at the root of all that, in my mind, is still education. And one of my favorite things to do, either with NAMI or with CIT training, is to lead with myths and truths about mental illness, which Joe had referenced. And the more we get people to understand what the issue truly is and not see what it's manifested by media and TV and the movies, I think the more we can get everybody to pitch in and treat this as we would treat any one of our loved ones who is having their worst day. In other words, I think the future can be bright in front of us, but it does take sacrifice and change in all aspects of this collaboration.
Thank you again, Dr. Thrasher. I really appreciate it. And again, encourage everyone to browse around our website to find other great resources to create a mentally healthy nation for all, where you live, learn, work, and worship. Thank you again for the great engagement. Sorry again about the technical difficulties. We are recording and we'll have this up. Thank you again for joining us, and have a great rest of your day.